Hi, this is Zoe. I'm back. This is part 2 of my NR224 week 3 wound checkoff skills for wound care. So I'm going to complete the portion of sterile dressing, wet to moist. And so in my last video, I ended it with hand hygiene. So my hands are clean. I'm going to start off with informing you that I do have sterile cotton tips and my sterile dressing change tray. And I'm going to go ahead and position my camera so you can see everything that I have here. Okay. So what I'm going to do first is I'm actually going to go ahead and open up my sterile dressing change tray. And I'm going to go over and under. And I'm actually going to grab my gloves and put my I'm going to get my cotton tipped applicators and I'm going to just throw it here inside of the tray. Hopefully it goes in without problems. Okay. And I'm going to grab my gloves. Sorry, I normally would not have done that, but there was a pop-up on my computer. Okay, so I'm going to go ahead and do my sterile gloves. And I'm keeping my hands up, and I'm opening up the gloves. Only touching outsides. Out. So I'm going to go ahead and pick up my gloves. I'm going to pick up this glove and put it on. Readjusting the fold. I'm actually going to grab this one with my thumb out and scooping in the inside and putting my hands in. My thumbs are out. I was touching the outside of that. I'm going to leave it. And I'm going to pick up the middle of this and take the sterile out of the way. Okay, so I'm going to go ahead and readjust my cotton tips without touching. Okay, so I'm going to take out what I don't need, which is going to be the rolled gauze. Throw that out. I'm going to throw out the tape for now because I can use that later. And I'm going to take out this extra padding. Don't need that. Scissors. Don't need that. Don't need that. Don't need my trash bag. I'm gonna leave my ABD pad in here. I might not use it because my wound is smaller, but if the wound was bigger, I would use it. I'm gonna move my 4x4s to the side, and I'm actually gonna move my cotton tip applicator right there. So I'm gonna take out my saline. And I'm going to go ahead and pour saline inside of the tray and label outside I'm pouring in. So I'm going to go ahead and put my 4x4 here, and I'm gonna go ahead and start fluffing out my 4x4s. So after me using the saline, I pushed it to the side and I'm not going to touch it anymore because it is no longer sterile. I'm just fluffing out my 4x4s and putting it into the saline, prepping my padding for the wound. I actually think I have enough. So my first one I'm going to squeeze out, and this one's actually going to go to my tunnel first, the tunnel at 5 o'clock. And I'm going to go ahead and hold it like that so I have control. I'm going to take my cotton tipped applicator and I'm going to start packing the tunnel. So I'm just going to gently put it in. I'm not going to shove it in there because we do want it loose. Because it was a small tunnel, I'm just kind of might actually cover the whole wound. Okay, and I probably could finish off with one more. So just fluffing it out. And just making sure that everything is covered. And again, I am lightly doing this. I'm not pressing it too hard or anything, and I'm not touching the outside of it. Okay. So now that this is covered, I'm going to go ahead and I'm not going to move the computer. It's going to stress me out. So I'm going to actually just leave it like this, and I'm going to place the 4x4 over it, the sterile 4x4 over it, and I'm going to get my tape, and I'm going to start taping up the wound. And it's going to be half on the tape and half on the skin. I'm just going to make sure that the tape is firmly on the skin and there's no holes. Just patting it down. Again, half on the 4x4 and half on the skin. Okay. And I'm actually going to get the sheet to write. And I'm going to go ahead and put the patient's, my initials and the dressing time and date. And it's about 6 o'clock. Military time. And I'm not going to put it directly on, but just maybe on the side below the lower extremity, and make sure that it's flat on the patient. Okay. So I'm going to go ahead and take off my gloves. And I'm disposing all of my things properly. And I am going to go ahead and make the bed. Oh my gosh. I'm going to go ahead and make the bed, put the bed at the right height, and I'm going to go ahead and lift the rail, assuming that I had the rail lowered. And I'm going to ask the patient if there's anything else that I can help for them, and if they have any questions. And I removed my sterile gloves, and I'm about to perform hand hygiene. And if they have any questions, they can ring their bell, and I'm going to hand them their call bell. And I'm going to go ahead and do hand hygiene again. And I'm also going to thank the patient when I'm leaving the room. So warm water. 3 to 4 pumps of soap. Circular motion, nails between my fingers, over my hands, face down. This is about 20 seconds, and washing my hands. Okay, drying my hands with a paper towel, wiping them. I'm going to get a new paper towel and go ahead and shut off the water. Again, I would thank the patient and let them know where I'm here for them if they need anything. And I will thank the patient and exiting the door. Thank you.